Hi, it's your friend Sara, and welcome to my YouTube channel. In this session, we're going to talk about our previous lesson, which was about internal genitalia. We're going to talk about ovaries and fallopian tubes, and also about menstrual cycle. So let's start with ovaries and fallopian tubes. The ovaries are about the size of almonds, and their main job is to produce eggs for reproduction, and also they release important hormones like estrogen and progesterone. They also respond to signals from the brain called LH and FSH. Every woman is born with a limited number of eggs. After puberty, usually one egg matures and is released each month. This process can lead to pregnancy. Some eggs naturally disappear over time. In most cycles, only one egg is released, but sometimes more than one can be released. As women get older, the ovaries become less active and hormone levels start to drop. When menopause happens, the ovaries stop releasing eggs entirely, so pregnancy is no longer possible. The fallopian tubes are two thin tubes about 10 to 14 centimeters long, and their main job is to carry the egg from the ovary to the uterus. And this is the place where usually fertilization happens and forming the very first cell of a new life called zygote. Let me explain it in a different way. As you can see here, this is the uterus, cervix, and the vagina, which we talked about in a previous session. This is fallopian tube and ovary. As you can see, the end of fallopian tubes aren't directly attached to the ovary. Instead, they have small finger-like shape structures called fimbria, which they can catch the egg from the ovary and carry it to the uterus. Let's talk about the menstrual cycle. How long does your period last? How many days do you bleed? Is your cycle regular? These are common questions that people always ask. If your period happens every 21 to 35 days and lasts between 3 and 10 days, that's considered completely normal. The menstrual cycle starts on the first day of your period and ends on the first day of the next one. Sometimes your menstrual cycle might happen earlier or later than usual, or even last longer or shorter than you expected. That it happens because of different issues like stress, illness, medication, or changes in hormonal level. If your bleeding is very painful, very heavy, or your cycle changes a lot, it's a good idea to see a doctor. That's it. I think it's enough for this session. I will back here as soon as possible, and we're going to talk about menstrual cycle and different phases in this cycle. If you like this kind of video, please like it and subscribe my channel and leave a comment below because it means a lot to me. Thank you. Bye.